how to include underrepresented communities in government and how to collaborate across divisions. So I'm going to start by talking a bit about me. I'm Max Masure. Like I said, I use they them pronouns. I'm a senior UX strategist, and I'm also an inclusion consultant and an author. I published my first book last year, and it's called Bildungssack, and it's about overcoming imposter syndrome, and it's also part memoir about my life as a trans person. And at the moment, I am working with Wondros. This is my creative agency, and we do amazing work. We most of the time pick clients who are in organizations, movements, government projects that are like really caring for humans. That's why I like working here. And one of the clients we have is the All of Us research program from the National Institute of Health. It's a program that enrolled more than 1 million people living in the US to gather data from them, health data, in order to get a more diverse research on health. Until now, really, all the research were made for getting data from cisgender white men, sometimes women, but really not nothing about people of color, people with disability, queer, LGBTQ people, and black and brown people. So this program is amazing because it's really focusing on getting this data to have a better care for underrepresented communities in the future. The researchers we have a high percentage of researchers from underrepresented communities and underrepresented communities in research. The way we do that, we are really working hard into having diverse people, diverse communities, have them be present, be in the journey of building the data set. And we do that by having a lot of in-person events. So we have a lot of community partners, people who are living in specific communities, and they have their own health centers, and we partner with them so they can enroll people from their community. We like this picture here is also like we have a few mobile assets that travel around the US to really go where people are and might not have access to healthcare and might not be aware of the program. We also partner with a lot of hospitals where people can enroll as well. And we also have, and it's very important as well, we have advisory boards from different communities, different parts and states from the US. And this is really helpful for us to have these check-ins with them. So we bring them some work, some question, co-creation sessions, in order to like stay really close to their needs and be able to like address those. The main one is black and brown communities really and others have been hurt by governments in the past, right? By having clinical trials on them without their consent, have like sickness given to them in order to study. So we have a hard work to do here, and it's constant work of like getting those people more informed and feeling safe to join. I wanted to talk today about a use case. I recently was tasked to redesign the homepage of the program. So this is the homepage that is live now at johnallovers.org. And I'm going to walk through the steps and how we worked for almost a year in order to have a lot of input and make sure we are addressing all the needs. And the goal was to increase the number of people who decided to register. So that's the timeline. That's how we split the time with the work we did. We started by doing some user experience research on the previous homepage, as well as potential participants to hear their fear, their concerns about the program. And last year, summer to fall, we built a lot of user experience wireframes, tweaking the copy, moving into user interface and picking illustrations, imagery. And then this is where we collaborated a lot with other divisions. I'm going to share more about that. And then we ended with some usability testing and tweaking the homepage again. And then the last part in this year, April, was implementation in order to launch on May 1st, which was a big national campaign for all of us. So let's talk about the user experience research. So we learned from, so that's the previous homepage. We learned that the homepage was not giving enough essential information. The visitors had to really look around and try to understand what is all of us. It was not clear from the get-go. And then that translated into 58% of visitors, the average, were just looking at the homepage and just leave, not taking any action. So we wanted to learn why, right? The data is the data, but it has to be coupled with qualitative research to understand what people were feeling. And the way we work at Wondrous and all of us is that we really always include folks from underrepresented communities and different age, different education. It's harder to find very low education below high school because those people are not really online. So that's part of the work we also do on the side, going in person and really going to them. For this one, we were doing online, so we were really higher than high school, and then different income as well. So we wanted to have a wide range of profiles, and we had Spanish and English interviews. And also folks who didn't know how to really use computers, like late adopters, people or like a bit older, and also people who really know how to use mobile or computers. We discovered a few main insights. I'm not going to go into all by one, but the most interesting was that they didn't understand the program, which is like a big issue when we present a website. They were not sure about what is all of us and who is behind, because the National Institute of Health was not really explained and shown, so there was a lack of legitimacy. And they didn't understand how to enroll. Is it online? Is it in person? Whether I have to sign or not? And the big one, we're still working a lot on that, is lack of trust in privacy protection, because you share your data, you share part of you, your body. And then we are extremely secure and everything, but didn't do a good job of explaining that. And the last one was the lack of representation. There was only like a couple of photos, and they were definitely not showing all the diversity that we want to the audience to be. So then we moved into the section where we were building wireframes, and this is where we really incorporated a lot of divisions from the NIH. So we have division of comms, communication, we have engagement, we have policy to know what we are saying is going to be like legal and safe to say. And we also worked, so we had a big team at Wondrous where we had also project manager, designers, UX design researchers. So we all gathered together. We had weekly meetings, and we went through the first of one of them. I know the screenshot is very small, but I can explain. So on the top left is the introduction with the homepage that we had, the previous one. The circle on the left is all the research insights that we had. So we presented that to them, and then the activity was to take all those insights and write sticky notes, and then we move them into that a very, very simple mock-up of sections that could be on the homepage. And that's how it took like maybe like 3 weeks, I think, of going back to it and have a lot of conversations and have input from each division of what should be said, and us, the division of UX for all of us where I'm part of, and the team at Wondrous, designers, were trying to really encourage the voice of the customer and like making sure the communities we wanted to reach would be actually their needs would be met. And this is where we like over like a couple of months we moved from this brainstorming wireframe on the left with the insights that we like agreed on focusing on. We started doing a low fidelity wireframe when same we had meetings all together to like comment, discuss of the layout, which should be first or not. Then we were able to move to the high fidelity wireframe and same like discussing, taking the time that we needed to have everyone involved to feel heard. So we would not have like at the end like a final product and someone would just like, hey, I wasn't involved in that. It doesn't work. I'm not okay with that. So we really planning all of that took time, but in creating the trust within the divisions was part of like half of the work. And then we had the user interface design, which we went for testing. So I wanted to say here that we continuously improve our processes, and what we're trying to do for next year is to incorporate even more um, uh, people from underrepresented communities to be on those meetings, some of those co-creation meetings, instead of just getting research. To already have people probably from the advisory boards or people we can recruit from the participants to help us make those decisions. So quickly, and that's the version of the homepage that was tested. And then we same we like highlighted the insights and we like here the numbers are like how we addressed some of the concerns that we had on the previous homepage. And then we same we recruited a lot of folks from different race and gender and degrees. And on the right, you can see what we are trying to test. That the content was cohesive, well paced, and clear. So we really worked a lot on the narrative, storytelling of the homepage, and how we explain things clearly. Just so you know, in those government work, the reading level is seventh grade. So we also have to explain very complex elements to like use plain language. And when we're inside the enrollment, the reading level is grade four. So it's even more like straight to the point, having short sentences, and it's part of like inclusion. It's part of accessibility and making sure folks who don't have like have a low literacy can also participate, which is the goal of this program, right? And I wanted to share when we launched the homepage. We it was the it was at the moment where we had a national big effort to celebrate the 5 years of the program. So at the same time we launched the homepage on May 1st, 2023, a lot of the frontline staff of all of us who are recruiting people from hospitals, community centers, and you can see here the mobile assets on the right, picture on the right. They were having like a huge effort and trying to reach as many people as possible using great materials that was designed by the Wondrous team on the communication part. And then that was like a massive success. And you can see here on the left, that's how it could look in a community center. Here it's in Illinois, and that's the Hispanic community center. So this is just like a table, people who are like part of the All of Us research program, and they talk to people and just explain what it is and ask them if they want to enroll and what it means to be a participant. And on the picture on the right, that's the mobile unit where we have we have an exposition exhibit of what is health research and how they can enroll. And yeah, I wanted to finish with a bit of success metrics, which is a bit hard to know why or not. That's why I wanted to share the big national campaign because we had like a huge success in terms of registration, meaning people went to the homepage and decided to sign up. So it could be the homepage having a better narrative, explanation, better representation of communities, but it also so much effort was made that more people also came to the homepage. So we're not able to like exactly say what's the reason. So it's really like a big effort from both. And comparing for the same month in 2020, we also like more than double and the number of people who decided to register to really create an account and start enrolling. So that's it for me now. I wanted to really go quickly through that so we have time for Q&A. I encourage you to look into joinallofus.org if you also want to be a participant and learn more. I did not say, but it's also part of the program is that we actually bring back results to the participants, which is very rare, if not never, in those type of health research. So people who donate their samples for having to be part of like the program and having their DNA included in the research, they actually receive their own DNA results for free in composition. They also have a gift card for coming into a hospital to have their blood drawn, and they also answer surveys regularly. That all of that is made available for the researchers, and they can see which studies have been discovered, which health research has been uncovered thanks to all the data we gathered. And that's it for me. I put here some links to find me on my website, maxmisure.com. You can reach out to me by email at Montrose, maxm@montrose.com. I'm pretty active in my Instagram most of the time, and I share about inclusion, inclusive design, my journey as a trans person and an author. So it's Max Measure on Instagram. I'm on LinkedIn at Max Measure, and also put the two links like wonders.com if you want to learn more about the work we do, and then the homepage, joinallofus.org, and you can go through it and tell me what you think. Always happy to hear feedback. Thank you.
Brilliant timing, Max. We have a couple of questions for you. So I'll just take your presentation off stage so we can put these on stage. So the first question we have are, what methods did you take to make people of underrepresented communities more comfortable in participating?
Yeah, so we have like still improving our process. The ideal one is really going in person where they are. So that's part of something we are building now to really have that done. It was hard because with COVID, that was what was done before COVID, but it's definitely for the past 3 years was less easy. So we are rebuilding that capacity to bring them to go to them in person. What we do is like we also have a diverse team at the division of UX. So we also have LGBT queer folks. We have brown and black folks, people with different religions, with disabilities. Like we also build like a diverse team. I think it's critical to do inclusive design to actually have a diverse team. So what we do is like we have folks interviewing that are from diverse communities as well. So a black participant will feel at ease, more at ease if it's a black person talking to them, or at least someone from the black or brown communities. Like we are like really caring for that. We are very careful about, for example, we do not allow other viewers during the sessions. It's only the person is talking and recording, or a scribe, someone takes notes if we cannot record. We don't keep the videos. We ask consent to only record the audio, and if they're fine with that, knowing it's really just for us. So we're like taking as much precaution to make them like you can talk to us. It's gonna be safe, but definitely that's an ongoing process to improve all the time. And really, what I really want is for us to have like I think we did some focus groups recently that was also powerful from a specific community, so they can also share their own concern and fears, and there's a lot of them, right? Like the black and brown communities have been really hit hard with unacceptable past in health research. So we're like always talking and addressing that.
Sorry, just unmuting myself. That was a great answer. The next question we have is, how do you intend to track or have tracked progress and viability even after the program slash events?
Um, I'm gonna assume you're talking about the homepage data. I'm not sure, like if it's so. I'm gonna assume it's but like how to track the progress on the homepage and like what we see. So we have like a strong division of data at the National Institute of Health. And we track a lot of elements, and we, as a division of UX, we also work hard into building better data, like really understand who are the people who are actually joining. So we work hard to like find the fine line between getting information from people about their race, gender, other aspects of diversity. So we ask that through the first survey. So we can regroup and say, oh, those people were actually less registration, but they actually do the whole consent enrollment and they're very active. Or on the contrary, we have a lot of people who are creating account but they don't really follow through. So we like track all that journey, right? It's not just the homepage. The homepage is one entrance to the journey. We have a lot of community partners who are also bringing people directly to the platform to sign consent and start answering surveys and so on. So there's a lot of data that we track and always building more, asking for more to have a better sense for underrepresented communities, how they react, what are their feelings, why do they stop at this specific point in the journey?
Awesome, thank you so much. We have one last question. So, how can this research be used more frequently? Can these participants be used more frequently? That's quite an interesting one.
Yeah, so we use different ways to talk to folks. We use some platform online. We also like recruit diverse folks and do focus groups, like I said. So that's what I want to build this coming years. Really have like a set of folks that can actually participate. So that's one of the goals for the division of UX, like increase co-creation, which was always for me like a big goal in all the years I worked in UX. Right, it's like that's the best. Like you can actually have people in the room talking about their